Hey, it's Dr. Jeff. I am talking about Hashimoto's today and thyroid conditions. And one of the biggest misconceptions why women don't get better in the medical system with thyroid disease is, I'm going to say something that might be a little bit controversial, but it's the truth, and it's a fact that it's mostly never a thyroid problem. So if you think about thyroid hormones, we have T3, which is the active form of thyroid hormone that our cells actually use. And then we have T4, which is manufactured by the thyroid gland, that is inactive and cannot be utilized by the cells of our body unless it is converted into T3. And that conversion happens in the gut. So what happens in the medical system, whether it's a low thyroid issue, whether it's Hashimoto's and there's an autoimmune component, what the medical doctors do is they test your blood levels of thyroid hormone and then they give you medications for low T3. And you will take this drug for the rest of your life, while other things subsequently fall apart regarding your health. And here's why. Only 20% of the T3 that our cells use is actually made by the thyroid gland. 80% of the T3 that our cells actually utilize is converted from T4 in the gut. Converted from T4 to T3, this conversion happens in the gut. If there are gut issues, if there's high levels of inflammation, there's 7 inflammatory markers in the gut that I measure, there is a mucous membrane or a mucus lining that should be there on the intestinal lining that's very protective against overgrowth of bad bacteria. If there's overgrowth of bacteria, undergrowth of good, if there's any infections, there could be parasites, there can be viruses. Just had a patient have a pretty significant norovirus infection in her gut. There can be worms, there can be candidiase fungus, there can be infectious bacteria, if I didn't say that already. And we look for all of these things because if there is high inflammation, if there's infections, if the gut lining isn't intact, or if it's lost its integrity and there is some severity of leaky gut, then that also contributes to low levels of T3 because, like I said, that conversion happens in the gut. So now when there's high levels of inflammation with leaky gut, this is what contributes to the Hashimoto's aspect or the autoimmune aspect of a thyroid condition. So how we reverse, and typically what shows up on blood work is they look at 2 different antibodies in the blood work, anti-thyroglobulin and thyroid peroxidase. These are the 2 antibodies that our immune system can create against the thyroid, and if these antibodies are elevated, that's how they diagnose with Hashimoto's. However, it's just a physical thing that's happening in your body. It's if you think of symptoms, this is exactly your body doing what it should do in the moment of time. So even though it's abnormal, we don't want high antibodies. It's your body's way of adapting, so to protect other things. So when we find high antibodies, we know that there's a gut issue. We do the stool test, we do the gut zoomer, and then we map out the entire GI tract. So in order to reverse and heal Hashimoto's or any thyroid condition for that matter, if you ignore the gut, if you ignore the adrenal glands, if you ignore sex hormones, then you're missing the whole point and you're going to be on these medications for the rest of your life. So if your doctor is only interested in serum levels of thyroid hormone and then putting and keeping you on medications for the rest of your life, that's not a good strategy in my book. Find a new doctor that knows how to reverse and heal by looking at the underlying cellular complications and why T3 is low to begin with, or why you have antibodies. And then we have all the strategies, natural strategies, to heal and reverse the thyroid gland naturally, depending on what shows up on the lab. So I hope this helps. I hope this brought some value. I hope this didn't confuse you even more, but this should bring some good clarity to, number 1, why women are on thyroid medication for the rest of their lives, and then number 2, some things to look for or ask about in order to reverse and heal naturally. So I love you guys. If you have any questions, comment, I'll be happy to help, and we'll talk soon. Bye-bye.